Cancer is often imagined as something sudden, painful, and obvious. But the truth is far more silent and far more dangerous. Many cancers do not shout. They whisper. And because these whispers are mistaken for everyday problems, diagnosis is often delayed, sometimes until it's too late. Today, let's talk about less known but extremely important warning signs of cancer. Signs that are commonly ignored, misattributed, or normalized. 1. Unexplained weight loss. Losing weight without trying may sound like good news, but unexplained weight loss is one of the earliest red flags of cancer. If a person loses more than 5 to 10% of body weight without dieting, exercising, or lifestyle changes, it needs attention. Cancer changes how the body uses energy. It silently consumes nutrients and alters metabolism long before pain appears. Especially in adults, unintentional weight loss is never normal. 2. Persistent fatigue. This is not the tiredness that improves with rest or sleep. Cancer-related fatigue is deep, constant, and disproportionate. Even small activities feel exhausting. People often say, "I'm tired all the time. I rest, but I don't feel refreshed." This happens because cancer affects oxygen delivery, nutrition, and immune function. If fatigue persists for weeks without explanation, it should not be ignored. 3. Non-healing ulcer or wound. A mouth ulcer that lasts more than 2 weeks, or a skin wound that refuses to heal. These are not small issues. Healthy tissue heals. Cancer-affected tissue does not. Oral cancers, skin cancers, and even blood disorders may first appear as non-healing lesions, painless but persistent. Time is the clue here. If healing doesn't happen, evaluation must. 4. Unusual bleeding or discharge. Bleeding that is unexpected, unexplained, or abnormal is a serious warning sign. This includes bleeding between menstrual cycles, bleeding after menopause, blood in urine, stool, or sputum, persistent foul-smelling vaginal discharge. Many cancers, announce themselves through abnormal bleeding because tumors damage fragile blood vessels. Never normalize bleeding that does not belong. 5. Change in bowel or bladder habits. Cancer does not always cause pain. Sometimes it causes patterns to change. Chronic constipation or diarrhea. Stools becoming thin or pencil-like. Increased frequency or pain during urination. These are signs of obstruction, irritation, or infiltration. When bodily habits change and stay changed, the body is asking for attention. 6. Persistent pain without clear cause. Pain that occurs at night, does not improve with treatment, has no clear injury or explanation, is especially concerning. Bone pain at night, persistent back pain, or headaches with vomiting are classic warning signs that are often misdiagnosed as routine problems. Remember, cancer pain usually comes late, but unexplained pain should never be ignored. 7. Change in a mole or skin lesion. Skin changes are among the most visible warning signs, yet frequently ignored. Watch for asymmetry, irregular borders, color change, increase in size, bleeding or itching. Skin cancer often announces itself quietly, through gradual change rather than sudden pain. When a mole changes, it deserves a closer look. 8. Painless, hard lumps. A lump that is painless, hard, fixed, gradually increasing, is more concerning than a painful one. Lumps in the breast, neck, armpit, or groin are often ignored because they don't hurt. But absence of pain does not mean absence of danger. 9. Persistent cough or hoarseness. A cough that lasts more than 3 weeks. Or a voice change without cold or infection. These can be early signs of lung or throat cancer. When irritation does not settle with treatment or time, it needs investigation. 10. Difficulty swallowing. Feeling like food is getting stuck, or progressive difficulty swallowing. These are warning signs of cancers of the esophagus or throat. Early symptoms are mild, and that's why they're ignored. 11. Early satiety and abdominal bloating. Feeling full after just a few bites. Persistent bloating without clear cause. These are early but critical signs of ovarian and abdominal cancers. Ovarian cancer is called the silent killer because symptoms are vague, but not absent. 12. Recurrent fever or infections. Repeated infections or unexplained fever, especially without obvious cause. This can be a sign of blood cancers like leukemia or lymphoma. When immunity behaves abnormally, it often reflects deeper problems. Very important truth. Cancer pain usually comes late. So remember this clearly. No pain does not mean no cancer. Silence does not equal safety. Golden awareness message. Early detection means simpler treatment, better recovery, higher survival. Delay means advanced disease, complex treatment, greater physical, emotional, and financial burden. Cancer is not always preventable, but late diagnosis often is. Listen to your body, respect the signals, and never ignore changes that persist. Because catching cancer early doesn't just save organs, it saves lives.